Sabida kumaval Imam Sinujay Pungal Bibambatal Lungadina Falia Kamal Jara Mamam Sabida kumaval Imam Sinujay Lambungan Bibambatal Lungadina Falia Kamal Jaram Mam Sheikh Ibrahim Afwal La 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 Madam Banfaki the Banam Zainabunjam Plago Saravan Gorlapurla Gurlagurla Surubal, my father, Allah. Mustafa la yarida Anisulam yarida Walayza yarida Kumeli baisan Mbakedo Zubiyam Kumeli mamam Kumeli mamam Dadu via molega ya Zabamba panisu Personne Wendowang Wenjanatul Mawa Srinzalim Bakanim La ilaha illallah La ilaha illallah La ilaha illallah Don rete dunre Dugum jam nyepio Don rete dunre Dugum jam nyepio Pulo misal minima pulo mi beltima Ya pulo jarama pulo mi beltima pulo mi salminima Putana veli Mi wandi Putana veli Sayedi Nando Kaludi Sayedi Nando Baifalbe Kode Adamaise Iliman Sure Zamba Demba Limatar Kupulo Pulo misalminima Pulo mi weltima Pulo yaw kay mayma nagangaw Pulo yaw kay mayma tulak bay Alay mi jogi chakori wunako Ey pulo dogata Pulo misalminima Pulo misalminima Wotonji de lamdo Subi lamdo dando haimum Sada nyago doko Pulo doko Sadamon mara jambar pulo ko jambar ala suram sura fulbe ala dandan danda fulbe yo pula ko yo yaro yeso e pulo misalmi Japulo misalmi nima Papa Japulo mi weltima my brother from another mother misalmi nima ayo yelayo yelelayo na mi weltim aplo tororo samangari jam yo giram ayo yelayo minde mi malima elenyon sekhoma ayo yelayo yelelayo na weltima Defu love fi looking defu gul pul gawtu way Waxulo fi looking waxagul bungagu fi la fekk yaa ngi toog di xoy bakun ku ci ngi dem yow fa la neex wax fa la la neex ku ci ngi xool yow ka la neex wax ko la la neex lum ci doon ne waay loolu taxul ñu ne waay allu be gayatu waay bayal sawar bukku ne baye wanam taxul moom mu jeex bayal sawar waay bay mama war waay Ugan nga yuuxu di bàkku yoote naan ay Takabani wa lolo takunyuda wa Sabudu fadba pon contain Bella la manta kandang ten Bella sabchichin suru ken.
Thank you, thank you, thank you, thank you, thank you. And you'll get to know a little bit about the singer we have among us this afternoon. And hello and welcome to the African Leadership Group Health and Wellness Virtual Forum on COVID-19 vaccine. My name is Papa Ja. I am the founder and executive director of the African Leadership Group. And for this specific program, the African Leadership Group has partnered with the Denver Mayor, Michael B. Hancock, Stride Community Health Center, Colorado Black Health Collaborative, and the Colorado Department of Public Health and Environment to host this virtual COVID-19 vaccine educational forum. The goal is to spread awareness of COVID-19 vaccine and the importance of getting vaccinated within our community. Let me share with you a little bit how it's going to work out throughout this forum, which will last about 2 hours. Viewers will be muted as you enter the forum, but you are invited to submit your question via chat. Please use the chat box to submit your question, because we understand that in this particular time, we have a lot of questions, and you have expert on this panel, and especially the mayor. So you can please start chatting your question, and we'll be collecting them and make sure that we'll ask those questions. So after the presentation, we'll turn your question into to make sure that we are hitting the issue that matters most to our community. If you are unable to stay for the entire event, be sure to look for the video, which will be posted on our African Leadership Group Facebook, also on our African Leadership Group website. Also, you can find the full bio of all our presenters today. So you can find all the information by visiting the African Leadership Group website, usalg.org. So thank you again for joining us for the live virtual discussion of COVID-19 and the vaccination. We have so many special guests this afternoon with us. And excuse me if you hear me say in the process evening, because I am in Africa and it's like 9 p.m. here. But and the current world that we are facing and the situation, there's a lot of things we can do virtually. And we understand through this platform, we have people that are joining us from all over the world, and we're happy to have you all, because what we are discussing this afternoon is affecting all of us. Now, the African Leadership Group has partnered with an artist, a musician, and a composer that really care about this issue. Not only is an issue that impacts our community in the United States, but it's an issue that impacts the community in Africa, especially in Senegal, where he's from. And he has really worked with us to put together a special song about COVID-19 to bring the awareness, to really mobilize and make sure that our community are educated and informed to get their vaccination. Carlou D, as you can see, he's an artist and from Senegal that have done a lot. And you will get to see him again, because there are certain things that we will be working on, and he will be joining us in Colorado very soon. Ladies and gentlemen, please help me welcome my friend, my brother, also a member of the African Leadership Group, Carlou D. Carlou, the floor is yours. Thank you.
Thank you, Bob. Hello, everyone. Thank you all for being here today. And thank you for inviting me to participate in this important gathering. This global pandemic is causing lots of pain and suffering here in Africa, just as it is in America. I know we all want to contribute to the solution, and I believe we all can. As a musical artist, I was inspired to write a song and encourage everyone to take this vaccine. It is a song of hope and a call to action. And I'm proud to partner with African Leadership Group to launch this exciting movement to take us from virus to vaccine to victory. This is my first public performance of the song. I start here with ALG. I hope you enjoy it. Thank you. We talking and suffering a lot about it. World is upside down about it. And now we have chance to live without talking about it. Let's erase it. Vaccine is not a political thing, but the way for us to save our life. Let's get serious, life is not a game. Go get your vaccine. Go get your vaccine. Go get it. Yeah. We talk it and suffer it a lot about it. What is upside down about it? And now we have chance to live without talking about it. Let's erase it. Vaccine is not a political thing, but the way for us to save our life. Let's get serious, life is not a game. Go get your vaccine. Go get your vaccine. Go get it, yeah. How many people have died by this virus? No matter how powerful, no matter how rich you are, you better stay home and save your life with your family and praise to the Lord to have mercy. May Jah the Almighty stop this virus. Let's get serious, life is not a game. Go get your vaccine. Go get your vaccine. Go get it. Yeah. Why don't we get it together? Why? Let's get it done, let's get it done. Why don't we get it together? Let's get it done, let's get it done. Let's get serious, life is not a game. Go get your Khalamir Bajo Febar bi Dofijar 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 Dofijar. Let's get serious, life is not a game. go get your vaccine.
Thank you, thank you,
Thank
thank
you.
you, thank you, Carlo. Thank you, thank you.
Thank you.
And I know we have people muted, that's why you cannot hear them clapping for you. But thank you for that special event, a message. And thank you so much for performing this song live for the first time with the African Leadership Group. And we truly look forward to have you in Denver, Colorado, to really get this song introduced to the broader community. So thank you so much, and we are very proud to count you as a friend and as a partner. Thank you, Carlo.
Thank you.
Now, we have a public announcement, and as you know, the COVID-19 has been a pandemic that really shook the entire world. And the state of Colorado and a lot of organizations reach out to LG to partner to make sure that we get the message out. So we have a public announcement we would like to share with you, especially with the COVID-19 and the vaccine. So Lori, please go ahead. I am Papa Jah, founder and executive director of the African Leadership Group. As an immigrant, I am no stranger to hard work and tough times. This past month have been some of the toughest. It's not easy being in a new country and dealing with the pandemic. My community needs to know that COVID vaccines are safe and will protect us against COVID. The vaccine is how we begin to heal and live without fear. I'm getting mine as soon as I can. Help me power our comeback. Thank you so much, Lori. And again, here is the reality. The reality is, as a community, as immigrant, we are no stranger to facing challenges and tough times. But we also know our community is so unique in a sense of how we deal with things, how we relate information. And we know that we are so unique into, in order to believe and trust into something, especially when it comes to vaccine, we need to have expert and the voice from our own community. And that's what you will get to hear this afternoon. That's what you will get to see this afternoon. And the state of Colorado, the mayor, all the elected officials, and the hospital, they understood that and they reached out to partner with the African Leadership Group. I want to let you know on this platform, you are safe. On this platform, all information you will be receiving will be accurate, will be vetted, and you are safe here also to ask your question. We know that we need to get vaccinated. And if you've been around the African Leadership Group, you know that we are not an organization that sit on the sideline and wait to be told what to do. On that note, we took action. We will be hosting a COVID-19 vaccine clinic. Please note it on your calendar on April 17 at the African Leadership Group office. Please visit our website starting on April 7 to register, and also, most importantly, to get your friends, community members to register. That's the main reason we wanted to lead with this forum, to give you the information you need about the vaccine, and also for you to get a chance to join us on April 17. If you are interested, visit our website, usalg.org, or please send us an email at info@usalg.org, or you can give us a call at 303-862-4062. So please note it on your calendar, help us spread the word, help us get our community get vaccinated. Now, everything that we do, we need to do it with partner. We need to do it with collaboration. But most importantly, we need to do it with elected officials that we call friends, because they are part of us, they represent us, they take our voice and really go to represent us. Denver Mayor Michael B. Hancock is no stranger to our community. He's a friend, he's a familiar face. We have seen him days after days, situation after situation. I remember that when we had the George family situation, he took the time to come to visit the family to present his condolences. I don't need to tell you that he is the 45th mayor and the second African American to hold this position. Raised in the Mile High City since 10 months old, his passion for Denver and his people continue to drive the work that he and his administration do each day. We also know that since the COVID-19 hit, the mayor stood up and really took it on his own to make sure the Denver city is safe. We are safe as a community, and it's truly an honor for me to introduce you to Denver Mayor Michael B. Hancock, a friend of the African Leadership Group, a brother of mine. Mr. Mayor, we welcome you. Please, the platform is yours. We can't hear you, Mr. Mayor. I don't know if you are with us.
Yes, you're muted. You're muted, Mayor. Where are you?
All right. So he will be joining us here.
He is co-host now. Sorry, we didn't make him co-host. Mayor is on now.
All right, thank you.
Thank you very much. I was trying to type you, let you know the host has got to let me unmute myself. Good afternoon, everyone. Papa Dia, thank you so very much. To Chairman Pessima, thank you as well to Lori Collier and all the other board members of the African Leadership Group. Thank you for the invitation to join you today and to talk about this very important issue in the life of our community. Papa Dia pointed out the fact that the moment this pandemic befell us, we have been busy, focused on doing everything we could to spread the information on how we protect ourselves, our families, and ultimately the community. Today, we recognize as we look back on a year of this pandemic that this has been a year that this generation of people have never seen before. And hopefully, by the grace of God, we will never see again. 130 million people have been infected with this virus worldwide. 2.8 million people have lost their lives worldwide. In Denver, Colorado, we've lost 530 souls that last year were with us, and today they are not due to this virus. And so we all agree, we have experienced this a year like none other, and we all have gone through the challenges of whether it's working from home. Some of us have lost our jobs. Maybe some of us have been infected and lost loved ones. I know that I stopped counting at 13 of the people that I've lost since the beginning of this pandemic. And it's been a difficult year for all of us. Our economy is much different than it was at the turn of the new year when it became 2020. And so we have to begin to rebuild. And as difficult and challenging as 2020 and the first part of 2021 has been, we do see a light at the end of the tunnel, and that's why we're here. And let me, by the way, if I can digress for a moment and celebrate the artist, Lucard, that song was phenomenal. And what I enjoyed the most was to watch everyone start moving their heads and just bopping to it. That's what we do as a people, number one. We love rhythm, but two, the message was pointed and it was clear to get the vaccine. And life is not a game. And so I appreciate you being very direct and pointed about that and bringing such a beautiful message. So we're in this place called Rescue and Recovery, or Rescue to Recovery. Rescue is really about getting needles into as many arms as we possibly can. And recovery is about, once we've done that, or we're well on our way to doing that, it's about recovering with ourselves, with our own mental health and physical health, as well as economically, getting back to work for some of us, maybe just going physically back to work for some of us, getting our children back to a place where they feel healthy and safe and maybe involved in school or some summer activity. We're close. But as Papa Dia pointed out, we talk about 130 million people who have been infected, 2.8 million. We as Black people are disproportionately represented in those numbers. And it's unfortunate. It's all over the world. And which means we have to focus on really encouraging people to do what's necessary to protect themselves and to protect their families. And so from the very beginning, I have been doing these type of panels for every community in the city, particularly the ones who are perennially overlooked and underserved, and oftentimes are not the first ones to say, I'll get the vaccine. We got to be real about our history and why we distrust the medical system the way we do. We know that we have been used as guinea pigs, if you will, tested. It has left us scarred through generations. 40 years, the Tuskegee experiment happened here in the US. Today, they continue to do experiments with our people, our brothers and sisters back on the mainland. in Africa, the homeland. And so we have got to work through those fears, acknowledge them and be real about them, but also be honest with ourselves and knowing that until we get the vaccine and it is proliferate throughout our community, we are not safe. And we've got to encourage folks, as the song says, the artist said, encourage folks to get the vaccine. Let me just dispel some myths and then I'll stop. I know you've got very, very important messages and work to do today. One, I just want to dispel the myth. The vaccine is safe. The trials that this vaccine went through, or all the vaccines went through, are no different than any other vaccine that we've taken in our lifetime. And the reality is that as African Americans and other people of color, we were represented in these trials. Tens of thousands of people were a part of these trials, and they are safe and they're effective. And it's important that we take this vaccine and know that it is safe. It went through the same trials, it went through the same motions, maybe expedited, but the same benchmarks had to be met in the approval, the process of getting these vaccines approved. Secondly, it's free. No one should tell you it's not free. It is free. In this country, it is free. And our nation has already paid for it. And by the way, your citizen status does not matter. If you're a resident here, you can sign up to get the vaccine and you should not be asked about your status. And so I'm here to encourage us as a community. This is personal. Don't wait. Sign up for an appointment as soon as you can. And I know you're going to be given resources for you and your family while a part of this meeting today, but I also encourage you to go to denvergov.org /COVID-19 if you need additional resources. Be patient, but most importantly, get registered. And please, as of yesterday, everyone 16 years and older in Colorado can register for the vaccine. It's safe, it's free. Your citizen status does not matter. And folks, we need to make sure we get our people queued up, registered to get the vaccine. Again, Papa Dia, as always, my brother, thank you. And to all of you, it's really a pleasure to be with you today. Thank you for doing this. I can't tell you how important it is. We got to get our family and our communities out there. God bless you all. Thanks for having me.
Thank you so much, Mr. Mayor. And I hope you have time for a couple of questions. We have a lot of them coming in. So, but we let people know those that you won't have a chance to answer, we'll send it to the office. But there's a question that came in asking, will Denver at one point in time require a vaccine passport card, especially for travelers?
No.
Okay. So, and this, you already touched on it, but I just want to ask the question because I know everybody's concerned about this, how safe they are. So we got a question asking, I am concerned that in the beginning, the vaccine was going to take a couple of years before it was available. And then in a short period of time, there were 3 vaccines available. How do you really know they are safe, effective, and not just being put out there out of fear?
Yeah, no vaccine in this country comes to the marketplace without extensive testing. And I know you have Dr. Terry Richardson coming forward later on, and she will attest to you, these vaccines went through the same protocols in terms of the number of trials, by the way, all over the world, not just here in the United States, but the number of trials, the number of people who were part of the tests, part of the trials, were as extensive as they would be if it took 3 or 4 years. Let's be honest. Most vaccines that come to the market in America do take years to be approved. But this was titled Operation Warp Speed. It was about just expediting it, but it had to go through the same tests before it came to the marketplace for us to take the test. So they had, again, tens of thousands of people were part of the trials. And I see Dr. Terry Richardson says she will address it. Tens of thousands of people, 40,000 people all over the world were part of these trials, and they had to go through the same data collection, the same data proofing, and the same review by experts before it was ultimately approved for the marketplace. So we've been over this a lot, but I understand people's questioning. It was fast, it was intentional fast, but it had to go through the same checkpoints.
Thank you. And I'll ask this last question and the rest will send it to your office. You know, as African immigrant members of the African Leadership Group, we always felt your administration by our side. They always been there through a team, and a lot of other people from the office has always been there to support us on various issues. My question to you now on this issue of the pandemic and the vaccination, how can the African Leadership Group can help you and keep supporting you to get the word out there to get all members of our community vaccinated?
Well, I appreciate it, Papa. You know, I'll tell you that it starts right here. I mean, what you're doing here phenomenally is phenomenal. You got 54 people online. Every one of us know 3 people, 4 or 5. We start with our families and we get them lined up and queued up. And, you know, there was nothing more important to me than to make sure that my 81-year-old mother got vaccinated as soon as she could. And that's where it starts, at home. And then we come out to the community. And if we tell someone else, or maybe 5 other people, and they tell us 5, then we start penetrating our community. But the veracity, the honesty, and people who they trust come and saying, get this vaccine, that helps a lot. So keep spreading the word, keep having these type of conversations and addressing these real questions and helping to dispel the myths. But also, as I'm gonna say it again, acknowledge the real fear and pain that our people have toward the health system. We get it. We acknowledge it. That's how we begin to heal. We can't let it happen again. And that's why, as a public official, I'm coming out saying, I got the vaccine. I'm fine. My mother got it, and I would never subject my 81-year-old mother to something I was fearful would hurt her. I knew it was important for her to get vaccinated.
Thank you so much, Mr. Mayor. We have some questions we'll be sending to your office. And,
fantastic.
Yes, so, but we really want to thank you. You are a friend, a partner. And you can always count on us, and we'll be right there, especially this is a serious matter, and the only way out is to get vaccinated. We really appreciate your message. We really appreciate your vulnerability, letting us know you took it, you're safe, your mom took it, she's safe. And those are very important methods. So thank you so much and enjoy the rest of your weekend. So we'll hope to see you soon again.
You're awesome.
Thank you.
Thank you, Papa Dia. Take care, everyone.
All right, thank you. Thank you, Mr. Mayor. All right, we will carry on now. We will get to our program, and but before we do so, I just want to share with you a little bit about the African Leadership Group. I know most of you know about the African Leadership Group, and you've been involved and around, but you know, we just have this elevated speech that we put together, wanted to make sure that everybody understand the message, can relate it the same way. So I'm going to read it line by line so you can hope that it can resonate and give you a sense of who we are and what we do. And the entire team and committee members work on this to make it happen. ALG is an established Colorado nonprofit organization of 15 years created to serve the entire African immigrant community to help improve their quality of life. We do it through social, economic, and educational programs, such as youth empowerment and public speaking class, reaching thousands of individuals. Every year, during the month of August, we celebrate loudly and proudly the impact African immigrants have in the state of Colorado. If you go to our website, you can find this and feel free to use it and explain to people what ALG is about. But the reality is, all this work, we wouldn't be able to do it without the support of our funders and our sponsors. So we are very proud to count them as a partner, but also we are very grateful and thankful for their support. So every single one of them you see has made a difference. But also, if you know of any organization that are looking for organization to support, let us know, we'll reach out to them. But all these funders and organizations, we appreciate them for their help. Now, I wanna just bring Abdul as a board of director, also the chair of the Health and Wellness Committee, but today he is our MC. But Abdul have a heart for the community. He has served along my side for many, many years, and we are so grateful to have him because since he's been involved in the Health and Wellness Committee, so he's been making a difference. So this event we are here having, it comes from its entire committee because they think, plan, and have a vision for everything that matters to our community to figure out a way to educate, inform, and bring the resources. Please help me welcome Abdul Pesima, African Leadership Group Health and Wellness Committee Chair. Abdul, the floor is yours.
Thank you very much, Papa. Hey, Kaludi, your message was awesome. Your message music was awesome. And thank you also, Mayor Hancock, our able Mayor Hancock, for your powerful message to the community. Hello, and everyone. Hello to everyone. My name is Abdul Pesima, and will be your MC for the forum today. We have experts to talk with us about the vaccine in hopes of answering some of your biggest questions and important questions. We will introduce our first guest in a moment, but first, some few, house things that we want to update you on. As Papa mentioned, you'll be muted throughout the event. Please remember to submit your questions in the chat box. After the presentations, we will turn to some of your questions to make sure we are hitting on the important ones. I would like to recognize this moment and give a shout out to my able, amazing African Leadership Group Health and Wellness Committee members. We have here Pascal Ado, one of our able, she's been there way from the beginning. Pascal has been with us way from the beginning. And we also have Charmaine Musada. Well, Charmaine is not with us this afternoon because he's not feeling well. Charmaine, we are lifting you up to the Lord in prayer. And we pray that the Lord that we serve, whose a resurrection we celebrate tomorrow, will raise you up and heal you. And also we have Anatwa Kofi, as well as my son, Jusu Sawi. Thank you for your unwavering community services and work you do for the ALG Health and Wellness programs and events. We appreciate you very, very, very much. Again, please visit the ALG website, usalg.org, usalg.org. And if you want to know more about the speakers that we have today, the presenter that we have today, their bios are in our website. Please help me to welcome Dr. Susanna Deng, a COVID-19 Rapid Response Team lead at Colorado Department of Public Health and Environment. Susanna Deng is a medical doctor who trained in our home country, Sudan. Dr. Deng, the floor is yours.
Hello, good afternoon, everyone. Thank you for sharing your time with us. I will be presenting my slides, if Lori would bring them up, and we'll start right away. The first point that I wanted to talk about is the status of COVID-19 in Africa, because all of us, although we are here, it matters a lot to understand a little bit about the COVID-19 in Africa. As of last week, there are 3 million cases of COVID-19 that are reported in Africa. Although epidemiological and serological tests show that the cases are as much as 10 times, if not more. So the myth that COVID is not in Africa, it's not a lot, needs to really be busted and addressed. However, although Africa is a continent and the situation in Johannesburg is different from situation in Cairo, from Juba or Addis or any other city, there are certain advantages that Africa can have, and these are only mainly 2 when it comes to COVID-19. The first one is that Africa is the youngest continent. 60% of the population of Africa is under the age of 25. So in terms of disease burden, that would help a lot because as we know, COVID affects young people less, although that does not mean young people are completely immune from it. The other advantage is that there is low population density. People are spread in most of the regions and most of towns in Africa. People are spread out, and the population density when there is a high population density, you have a higher rate of infection, but when it's low, so the spread usually goes at a lower rate. However, The African continent has many inherent and other political and economic conditions that make it hard to address and tackle COVID-19. One of them is the simple lack of proper healthcare infrastructure in terms of access to testing, in terms of access to treatment, as well as in terms of having contact tracing. Also, in terms of social norms and traditions and cultures, it's very difficult for many of us to follow, or even hard to follow social distancing, isolation, and quarantine. And also in terms of economic conditions, even if some people are feeling sick, they would go to work because economically they are not able to sustain unemployment because they need to take care of their families. So all these factors really affect COVID-19 negatively. In terms of vaccination in Africa, the World Health Organization plus the World Bank, UNICEF has basically formed an alliance with 142 middle and low income countries and formed an alliance called COVAX, which stands for Coronavirus Global Access Alliance. And the main vaccine that is being distributed through this, especially to African countries, is AstraZeneca vaccine. And the importance of AstraZeneca vaccine is that logistically, it's easier to manage. It's not, one of the speakers is going to talk about the other two vaccines that are available, or the other three vaccines that are available that have totally different logistical and infrastructure requirement. But AstraZeneca is easier to manage. But even with AstraZeneca, there are places where it would be very hard to deliver these vaccines, and the infrastructure is still a big obstacle. I want to address the fact that many people believe that COVID-19 is not as a big problem in Africa as it is in other places. This would actually lead to make it difficult for many people to accept the restrictions that are being imposed in them, because they will have already answered that, hey, we don't have any COVID-19, so why are we being basically asked to stay at home and to observe social distancing and not go to work? Also, there is a problem of the fact that when the world believes that COVID-19 is not a problem in Africa, then they would not deliver more vaccines to the continent. As we speak now, 16% of the world population, which is basically the high income country, has total control of 60% of the vaccine supplies. So the rest of us, 80-something% of the world population, have to deal and have to only have access to 40% of the vaccine supplies, which is an injustice that is already baked into the system. For example, the US is planning to vaccinate 70% of its population by the middle of the year, while African countries are planning to only vaccinate 20% of their population by the end of the year, which would mean that coronavirus will continue to go unabated and to spread among the population in Africa. The main danger when coronavirus and when vaccine is not distributed equally is that the regions that are left without any vaccines become the ground for new mutations and new variants of viruses to spread to other countries, including the possibility of a new variant that would even overcome the vaccine. So I am inviting you to basically advocate for vaccination of the entire world population. And it's possible if there is less hoarding by the high income countries. So it's important that we vaccinate everyone, because no one is safe if there is any region that has coronavirus continuing unabated, because what will happen is that a possibility of a new variant that is strong, that is more lethal, and that would even overcome the vaccine that we already got can basically happen. Next slide. The other presenters are going to be talking about vaccine resistance, skepticism, and hesitance. But the most important thing that I want to point out here is that some of the resistance is coming from conspiracy theories, and some of them are coming from basically people not trusting how fast the vaccine was developed. As the mayor was alluded to, and as other speakers are going to be pointing out, this vaccine is safe. It is just that it's a different technology, which is a messenger RNA technology that allows for vaccine replication at a faster rate. Like for the last 100, 200, 300 years, vaccine development has depended on a biological process that can take weeks and sometimes months. But messenger RNA can be replicated within minutes. So it is faster to replicate and it's faster to manufacture. The other skepticism that is legitimate is the fact that Black bodies throughout history have been abused by the medical system. But we can assure you that many of our people were represented in these research, and the world is changing. These companies cannot afford to hurt other people because we are here and we are able to speak up for our people. So we do trust this vaccine. These vaccines were tried. These vaccines are safe, and it's best that we start getting vaccinated. Next slide. Finally, I'm going to ask you to basically stop believing that you are invincible. It's important to get the vaccine for individual and medical reason, as well as a collective and public health reasons. Even if you are young, and even if from public health perspective, young people do not get as sick as older population, still there is no way of knowing for sure if you are going to be affected by it or not. You have no way of knowing for sure that, yes, if I get COVID-19, I'm not going to get sick. There is no way to know that. The disease burden is really huge. You are affecting, when you get sick with COVID, sometimes people can get sick for months, which might lead to you infecting other members of your family. It might lead to you losing your job. And also, when you don't get vaccinated, you can actually encourage the spread and the mutation of the virus, so that new viral mutations would come up and would even affect your family and friends and community even more severely. So this fight between this fight in the pandemic is basically between two things, two forces: the force of vaccination and the force of rate of infection. We need to vaccinate more people so that we overcome the virus. Otherwise, when the virus continue to spread unabated, it will become stronger, it will become more lethal. And for us, our best way to fight this virus is to get vaccinated. So please join the battle, get vaccinated, invite your friends to get vaccinated, and encourage your community to get vaccinated. Thank you. I have references here that we would encourage you to go ahead and look at if you're interested. Thank you.
Oh, thank you so much, Dr. Deng. We really appreciate you. We just wanted to know that there is somebody by your same last name, Dr. Deng, also
Yes.
in Sudan.
Yes.
You know, that was also on, and thank you.
Oh, he is a great gentleman. I'm happy to see him here. He's a very good economist. He has Africa at his heart, and I thank him so much for being here.
Thank you, Dr. Deng. You know, we appreciate you very, very, very much. Next, we have a vaccine testimonial, Anatwa Kofi. Please share your experience.
Hello, everybody. Thank you so much for being here. So my name is Anatua Kofi. I'm a community member, and also I'm a care manager at Stride. So I received the first dose of the COVID vaccine on December 27th, and the second dose 3 weeks later, around January 28th. So I did not have any reaction when I got the first one, but I did get a little reaction when I got the second one. I got the chills, the body ache, what's kind of expected. I work at the clinic, so I had the opportunity to talk to some of the providers over there. I have one here, Heather Kelly. So every time I have a question, I ask her, and she had the answer for me. So I kind of know what to expect. So as I said, the second one, I got the chill, the body ache, like most of us here are from Africa, so we understand, we know what is malaria. So I felt that I was having malaria, but it only lasted for 24 hours. That was my experience, just 24 hours. After 24 hours, I felt better. I took a Tylenol, and later on I took a ibuprofen for the body ache. So I felt better. So for me, I chose to take the vaccine for several reasons. As a public health professional, I understand the importance of vaccination. Prevention is better than cure. So for me, taking the vaccine was a no-brainer. I did it for myself. I did it for my family, for my community. I want to go out. I'm tired of staying home. So I have to do my part. So I got the vaccine. Also for the patients I work with, and also for the people I work, my coworkers in the clinic. The vaccine is the only preventative measure we have so far, beside the wearing of the mask and the social distancing. Also, for me, it's very important to get vaccinated. As I said, as a public health professional, I understand the importance of getting the vaccine. So I didn't even think twice. I just went for it because I know for sure that it works. I did my homework, I asked questions, I read a lot about the vaccine, all three of them. And so I got them in at work, and it was okay. Finally, it's essential to get your vaccination while it's free. As the mayor said, the vaccine is free for everybody, regardless of your residency statute. You just have to register, and get vaccinated. And we said it at the beginning of this program. On April 17th, ALG will host a vaccine program. So please register and get your vaccine. Today is an opportunity for you to ask the questions that you have. You have experts here. Please answer your questions. And I hope that you make the decision to get vaccinated. Thank you.
Thank you so much, and we really appreciate for sharing your story. Now I would like to welcome the representatives from Stride Community Health Centers, Dr. Stephanie Sandro, a family medicine physician and the Associate Director of Clinical Quality and Clinical Risk Mitigation, and Heather Kelly, a family nurse practitioner and a regional medical director. Heather, the floor is yours, please.
Hi, everybody. Can you hear me okay? Am I unmuted?
We can hear you.
We can hear you.
Oh, great. Thank you again for having us. We're really honored and excited to be here. I'm going to give you a little overview of Stride Community Health Centers initially, and then Dr. Sando will talk about COVID-19 through the lens of health equity. You can move on to the next slide. Perfect. So again, first an overview, and then we'll kind of get into the meat of the presentation. And the discussion and questions will actually save to the end of all of the presentations, to the end of the forum. So we're called Stride now, but originally we were established in 1989 as Metro Denver Provider Network in Aurora. And the goal was to serve residents who didn't qualify for Denver city services. And in the first year, we served about 800 patients. So fast forward to 2020, and we are now Stride Community Health Center, and we served more than 56,000 patients across 15 locations last year. So we've really grown a lot. And we provide care to a 5-county service area, and we have one of the largest population bases of any of the community health centers in Colorado. Our mission is really to partner with the community to provide culturally sensitive, excellent health services and meet the needs of both the individual and the community where we live and work. We try to really empower individuals to live the lives they want through compassionate healthcare. And our values are integrity, compassion, accountability, respect, and excellence. Our goal is to deliver integrated primary care. So when somebody comes to a clinic appointment, we can provide medical services, behavioral health services, care coordination, health education, really those wraparound services that people are needing to make sure that the physical, emotional, mental health is all being addressed, ideally in one place. We also have many different departments, including a Ryan White clinic for our HIV patients. We have MAT services for substance abuse. We have a refugee clinic and service line. So we try to really take care of the entire community. You can move to the next slide, please. This is just a recap of kind of what I just explained. We served about 56,000 patients in 2020. Over 40% were Medicaid, over 25% were uninsured. We estimate that we speak about 112 languages within our clinic walls, our patients and our employees. 80% are low income, so 200% below the poverty level. 57% identify as Black or people of color, and 30% of our patients are served a language other than English. I would estimate it's probably over 30%, but 30% is what we got in our survey respondents. This next slide is really a transitional slide to Dr. Sandhu's presentation and about COVID-19 and equity. And you can take a look at these pictures later, but it's basically 3 individuals watching a baseball game and trying to see what's happening. And it represents the difference between equality versus equity. And in the last picture, the 3 individuals are all able to see what's going on and have access to the game without any accommodations because the systemic barriers have all been removed. And that's really the ultimate goal. And I will transition now to Dr. Sandhu to give you a little more information. And we would love to see you at Stride for medical, dental, behavioral health, any kind of care. We'd love to take care of you.
Thanks, Heather.
Sure.
So I just wanted to take a step back and talk about what is COVID-19. So it's a virus, and it actually says it right there in its name. So it stands for a coronavirus. And it is true that coronaviruses have been around for a long time, but this particular one is a little unique, and we can go through some of the reasons why. But the D in COVID-19 stands for disease, VI for virus, CO for corona. Next slide. So I did want to bring up this slide because I think there's a lot of confusion out there about what are the symptoms of COVID-19. And I think it's really important to know that there's a lot of symptoms that can represent COVID-19. So if you are having any of these symptoms, yes, things are looking a little better with the vaccine, but COVID-19 is still out there, and I strongly encourage you to get tested. Your symptoms can occur 2 to 14 days after an exposure. So be careful about assuming after an exposure, I'm feeling good, it's only been 3 days, I'm probably in the clear, because you can very much so get sick later on. Fevers, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, nausea, vomiting, or diarrhea. And I have seen COVID-19 present in every which way. Sometimes it's just an isolated sore throat. So be careful about assuming you don't have COVID-19 just because you weren't really sick. It's really important to go in and get tested, not just for yourself, but for your community, because by getting tested, you can isolate and help prevent the spread and prevent yourself from spreading it to other people. So please get tested. We know that testing is an area we've seen a lot of inequity when we look through the lens of equity and in our communities. There's lots of folks who have access to concierge services, very high cost testing, and that is an advantage for them. And we at Stride really wanted to offer testing services to decrease that disparity gap and make testing available to all of our patients regardless of their ability to sign up online. They can just show up, remove those technology barriers. It was a drive-through testing where you didn't have to sign up beforehand, and making sure that people can get access to testing regardless of what language you speak, and have access to it, because it has been a huge equity issue. We've seen people who can get testing to have a holiday, a party in Hollywood, but they can't get testing when they're sick. And so that's been a huge equity issue. So I encourage you guys to look for Stride and your other community partners to get testing if you need it. Next slide. And so like I mentioned, you should get tested if you have symptoms. Also, if you're close contact. Now, something that's really exciting is we know that if you're vaccinated, you probably are okay. So we used to say that you have to quarantine if you have a close contact exposure. And now if you're fully vaccinated, that means the full 2 weeks after your second dose or first dose, if you get Johnson & Johnson, you actually don't have to quarantine. So that's a huge bonus of getting vaccinated, right? You might save yourself from having to stay home. And that's because we know vaccines are very effective. But getting tested after an exposure is also important. And sometimes the health department might ask someone to get tested if they're trying to investigate an outbreak, and that's another reason they get tested. And like I mentioned, it has been very challenging for some communities to have access to testing, and Stride has really tried to focus on reducing that disparity gap. Next slide. So I wanted to talk about the difference between isolation and quarantine. If you could just go back, I think you missed it. Isolation is when you are sick and when you have likely COVID-19. Quarantine is when you might have been exposed. This, like has been mentioned, has been a huge equity issue. We know a lot of our communities, it's very hard to isolate in your own bedroom with your own bathroom away from your family, especially in our high dense areas like Denver community, Aurora community, where families live multi-generationally together. And we've seen a lot of that spread within the community households. And so that's been a big challenge. We also know that staying home in quarantine has been a huge privilege. If you are self-employed or you work for an employer who hasn't provided you with sick pay, you might be less able to financially stay home if you've been exposed. So there's a lot of intersection between equity and this disease at many different layers. Next slide. So how do we fight it? So we've spent a lot of time talking today about vaccines, and I 100% want to reiterate that vaccines are the way out of this pandemic. It is so vital that all of you get your vaccine when it is available to you. We know that medications, unfortunately, aren't going to stop this pandemic, at least in our current state. We did have some promising antibody treatments recently come out. They're hard to access, and actually they're starting to show some resistance to some of the variants, which is really unfortunate, but there's no real treatment in the outpatient setting that's been shown to be super effective at stopping this pandemic. We have some mitigating measures we take when you're admitted if you're very sick that can help reduce your chance of death if you get COVID-19, but it really is the vaccines that are very, very important. And like has been said before, social distancing and masks are still so important. Our population is not vaccinated anywhere across the world at the level it needs to be. When you look at, I should say, particularly the US, Africa, Europe, all those countries, they're still, Asia are still in a situation where everyone needs to wear their masks, continue to social distance. There's some small exceptions, but for the most part, everyone needs to be wearing a mask and social distancing until we get to that threshold of herd immunity. Next slide. So I did want to take a sec and acknowledge that this pandemic has unfortunately disproportionately affected Black Americans, Indigenous communities, people of color in the United States, and that we see that across the board, no matter what state you live in. These are some early statistics that came out. I find this quite shocking. So this was earlier on. So this was when our death rate was highest in some area communities in the US. But places like Chicago, where as of April 6th, 30% of the state or city's population was African-American, but they represented 69% of the deaths. And that is why it's so important for all of our communities to get vaccinated, but particularly Black, Indigenous, and people of color communities, because we know that we're carrying that higher burden of death. We don't have a lot of time to talk about why that is. I think there's many factors that play into it, including injustice, lack of access to a lot of services and a lot of bias. And we know that that's wrong, and we want to fight those inequalities. But it's very important in this moment for us to recognize the importance of getting the vaccine out to those communities. Next slide. And this pattern we see across the United States, not just for cases, but as well as deaths. If you look, the colors in the orange represent a more proportional share of deaths or cases compared to their share of the population. Pretty consistently across the board, you will see that inequity. Next slide. This is age adjusted, so it's important to look at race statistics as age adjusted, because we know that life expectancies vary between different race and ethnicities. But when they standardize, this is from the CDC, you can see cases, you can see that across the board, you're continuing to see in that pattern. Next slide. And this is showing what we call rate ratios. So looking at what is your chance of getting sick compared to white non-Hispanic patients. And so once again, seeing that your chance of getting sick is higher if you are Indigenous, Black, or Hispanic, but also your chance of being hospitalized and of dying from COVID-19 is much higher. And so across the board, continuing to see those injustices. Next slide. And then this brings us full circle back to vaccinations. We know there's been a lot of barriers of getting a vaccine in this country. There's a lot of folks who have a lot of privilege and resources, a lot of ability to get in to get a vaccine. We want to remove those. We want it to be equal and fair, and everyone should be able to get a vaccine. Yes, it's free, but there's still a lot of technology barriers for people trying to get access to vaccines. We've seen disproportional distribution of vaccines in some states. And so I'm so excited we're having this forum to encourage people to go out and to raise awareness that Stride has a vaccine and really wants specifically to target our patient population and our community, which we know is beautiful and diverse, and bring them in to get this vaccine. Because unfortunately, we are seeing a higher proportion of the white population getting the vaccine compared to Black and Hispanic population, despite knowing that a large burden of our cases and deaths are actually happening amongst those communities of color. Next slide. So lastly, remember, go ahead and get signed up for the vaccine as soon as possible. Something really exciting that was mentioned earlier is it is now available to everyone 16 and up in Colorado as of Friday. Stride does have the Moderna vaccine, so that's only 18 and up. We don't currently have the Pfizer vaccine, but we are open to everyone. You don't have to be a Stride patient. I strongly encourage you guys to get on the wait list if you haven't had your vaccine. I was told today that our wait list was going to open up to everyone, regardless of whether you have a medical condition or regardless of whether where you work. It used to be that you had to fit into a certain category. It's now open to everyone. If you use this QR code, which will be in your slides, or if you visit this website, I actually find it easiest just to go to Google and type in Stride vaccine, and it takes you right to our sign up. You put your information in there and someone will call and register you. And we're very fortunate. We've been able to be allocated a lot of vaccines because we know that it is so important to get this vaccine out, in particular to the communities we serve. And I feel very privileged and blessed to be able to work at Stride and work with such a diverse community. I really love it. So thank you for having us today.
Thank you so much. Thank you so much, Dr. Stephanie. And Ms. Kelly, thank you so much for very, very educative presentation that you've done today. We appreciate you. Now, I would like to turn it over to Laurie. Laurie, the project manager and event planner with the African Leadership Group. She will do the raffle. Take it away, lady.
All right, thank you. Can you guys hear me? Yes. Thank you, Abdul, presenters, testimonials, and I tell you, Carlo D, that was amazing performance. Now it's time for the raffle. Let's stretch our fingers and get them ready to type in a chat box. We will have one raffle, but 2 winners. One raffle and 2 winners. And here are your instructions. First, wait till I say go. Wait till I say go. As listed on the screen, you're gonna pick a number between 50 and 981. 50 and 981. You will submit your answer. You will submit your answer your number via chat. When I say go, you will have 20 seconds to type in your number. So let's get those fingers ready. The first two people, either who get the exact number or closest to the numbers, will be the winner, and we will have a timestamp. The number is pre-selected and only I know. It will be displayed on the screen after the 20 seconds. Our team will announce the winners at the end of the presentation, verbally and via the chat. You must be present to win. Once we announce the winners, please chat your email and your mailing address directly to me, Lori Collier, and I will get those mailed out to you. All right. Are we ready? Set. Go. Stop. Okay, time. You ready to see the answer? Here it comes. You see it? 555. Again, we will gather up the answers, and we will let you guys know at the end of the presentation who the winners are. Thank you.
Hey, thank
Abdul,
you.
back to you.
Yes, ma'am. Thank you, Laurie. We appreciate you very, very much. We know you're the brain behind most of the things that we do, in this forum as such,
Thank you, Abdul.
Yeah, nice job. So after our last presenter, we will have the question and answer session. If we run out of time and your questions have not been answered, we will compile and send them to the various persons to answer for us. Once we receive the answers from the expert, we will post them on ALG website, as well as send them to the registered guest. Please make sure that we have your email address. You can submit that via chat as well. Our last speaker for today, she's not the least, but she's our last speaker for today, is Dr. Terry Richardson, who has over 32 years of experience as a clinician, health educator, mentor, and volunteer in the health arena. She's currently a board-certified internalist at Kaiser Permanente, Colorado. She's also the Colorado Black Health Collaborative Vice Chair of the board. Dr. Richardson, you have the floor.
Okay, thank you. Am I showing up? Next slide, please. Thank you all for attending on a Saturday. This is great that we still have a large number of people on this call. And so I'm going to talk a little bit about the vaccine. You all have heard bits and pieces of it already, but I like what Dr. Kizzmekia Corbett says about the COVID-19 vaccine. She says it's community service, which implies it's not about you, it's about the community and getting back to doing things the way we like to do things. So community service, and she's one of the scientists, a Black American scientist that helped develop the Moderna vaccine. On to the next slide. So we have to acknowledge, as the mayor said, that there have been some concerns in the Black community. Some of these things have been already mentioned, so I'm not gonna go through all of them, but I know that people were concerned about it being developed way too quickly. And the fact of the matter is that a lot of money and manpower was dedicated to production of the vaccine due to the pandemic. The number of lives that were lost, it was viewed as very important and worth putting a lot of money to it. Were there any of us in the trials? How many were in the trials? We just don't trust the process. We don't trust the government. Are we being used as guinea pigs? Why can't we just wait and see what happens? Will they even come to our neighborhood? And we've seen that issue where some other populations, non-Black, non-people of color, had made it to the front of the line. We'll probably be at the back of the bus. We're trying to overcome some of those things right now. And then people know about the Tuskegee experiment, as we called it, the study that went on for 40 years, where the men were not treated even when there was a treatment available. So those are some of the concerns that are legitimate, but let's remember that this is about community service, and we need 75 to 80% of people to be vaccinated in order for us to feel safe and get back to business as usual, so to speak. On to the next slide. So we're going to talk about the vaccines that are available in the US at this time. Next slide. So I know that China was bashed a lot early on, but actually it was in January of 2021 that China released a genetic sequence of the virus. And because of this, the pharmaceutical companies were able to start developing vaccines. All the current vaccines that we have right now lead to the same endpoint, which is making the spike protein that creates an immune response in our body. So antibodies and immune cells are generated based on the spike protein. The trials have prioritized people of color. It's really a good start. In the past, because of some of the things that have happened, the disregard of the Black body in our health, we were not participating in the trials, but they've worked hard. They've worked with a lot of Black groups, professionals, to encourage our people to participate in these trials. And Moderna had 37% people of color in their trial. They also had elderly and people with chronic diseases, which is something that you don't see as often. Pfizer had 30% Latinx and African American, and Johnson & Johnson, or Janssen, almost 20% Black in their trials. On to the next slide, please. Vaccines. Right now we have three. We have Pfizer and Moderna. We have the Janssen, but I like to call it the J&J or Johnson & Johnson, because we know about the baby shampoo and the lotions and all that, and that sounds more familiar. So I just call it the J&J. They all went through the same phases as far as the clinical trials as any other product. So people are worried about, hey, warp speed, does that mean they skipped the phases? Does that mean they didn't really do it the same way as usual? The answer is no, nothing was skipped. They moved, they expedited, they overlapped some of the phases, and so they were able to get this vaccine out here and start saving some lives. The FDA, they're all FDA approved, at least through the emergency use authorization. They're safe and effective. And just like the mayor said, I got my vaccine. I'm a person, I'm a doctor, but I had some fear in getting it. But I said, people are dying and I need to be an example. So I marched myself over there and got vaccinated. And I put it on Facebook so people can see it was real. I let them see every step of the way that this wasn't a fake, photo op, that I actually got the vaccine. On to the next slide. And then just briefly about these vaccines. There are two different types that we have available. There's a messenger RNA, which is the Moderna and Pfizer. They both require 2 doses. The Pfizer 21 days apart, the Moderna 28 days apart. And to be fully vaccinated, you need to get both vaccines for the Moderna and Pfizer. You need to get both doses. They're both about 95% effective. On to the next slide. And the mRNA vaccines, the messenger RNA, is kind of the instruction guide that instructs the body what to do to develop the immunity. And mRNA, this is something that's important for you all to know, because on Facebook and some of the other social media platforms, there's all kinds of mis and false information out there. These mRNA vaccines do not affect your DNA or change your genes. The mRNA is actually kind of a fragile substance, and is rapidly destroyed in the body in a couple of hours or a couple of days. And you cannot get COVID-19 from the vaccine. Let me say it again, you cannot get COVID-19 from the vaccine. Let's move on to the next slide. And then there's the Johnson & Johnson, or J&J, became available in March. The other ones were available in December. It's a different way. It's a kind of it's not a live virus. It's an adenovirus that carries the instructions. It cannot change your genes. And as far as the effectiveness of Johnson & Johnson for milder disease, in the US is about 72%. Worldwide is about 66% effective. But against the more severe COVID infections like death and hospitalization, it's between 85 and 86% effective. And that's what you really want to try to prevent, is hospitalizations and death. On to the next slide. And there's side effects, as with anything. Most people will at least get a sore arm. The rest of these side effects that you see listed here is really variable. Like Anatua mentioned, she didn't have a lot of symptoms. She had some of the fevers, chills, but some people have very few symptoms. They just have the arm soreness. And it really is quite individual. Some people say, hey, I was really sick for a few days. Others said, I just had a sore arm. And death is not considered to be something that you need to worry about much with these current vaccines. So on to the next slide. Getting the vaccine, let's move on to the next slide. I just want to reiterate, as was said earlier, that as of yesterday in Colorado, those that are eligible has been greatly expanded. We went through the phases. I mean, I was getting phase fatigue because we had 1A, then it was like 1A, 1, 2, 3. It was difficult, but right now, for those 16 and older, you are eligible for the vaccine. Now, for people under the age of 18, only the Pfizer, I believe it's only the Pfizer that has been tested and approved for those under the age of 18. And children right now under the age of 16 are not eligible, but Pfizer and some of the other vaccine makers have started the trials with children. So we'll be learning about that in the near future. I think a couple of months ago, they started doing some trials with children. And Colorado, we're ahead of the curve, is hoping to be fully immunized by June 2021. But I do have to say that we are having some equity issues when it comes to the vaccine. Just as the previous speaker mentioned, the white population has gotten to the front of the line. And so we see some inequity as far as getting the vaccine. But when it's your opportunity, be sure to go in and get vaccinated. They're now having a lot of pop-up clinics. People don't like that terminology, but there's opportunities at the Pepsi Center now called the Ball Center. There's lots of churches that are having opportunities. On to the next slide. And we already heard that it's free. If you're a resident in the state, you don't have to be a citizen. You are able to get the vaccine. You cannot be turned away if you cannot pay, and it is free, paid by the US government. On to the next slide. I'm going to skip over this. And there's more things you can do. We've heard about what can be done. You still need to, as much as possible, stay home. You don't need to congregate with a lot of people right now. There's still a lot to be learned about the vaccination, about this virus and the mutants or the variants. Wear your mask when you're out and about. Wash your hands, stay 6 feet apart. And in my last slide, I just want to present an opportunity for support. This is Colorado Black Health Collaborative has 2 B-Chart educators. They're there to help you get connected with vaccination sites, to offer some resources and support, because we know we need to be as healthy as possible. Some people have lost their jobs. Some people are homeschooling. So there's lots of challenges. A lot of mental health issues have come about. So we have 2 B-Chart educators there. You see their phone numbers, who you can call and find out where you can get connected to some of these resources. And I'll stop there because I know we want to leave lots of times for questions, and hopefully we'll be able to answer most of those.
Oh, thank you so much, Dr. Richardson. And we appreciate you very, very much. You've been always there for us, whenever we call upon you. This is not the first time we call upon you to come in and give presentations. Thank you very, very much. Really appreciate you. And we appreciate all of our speakers. And now it's time for questions. And they're all here to answer those questions, apart from our able Denver mayor, who has left us. But all the other presenters are here to help answer those questions. The first question I have, I think we have already answered some of those, but I think I will allow the presenters, especially from Stride, to talk a little bit about it. It says here, how do we get to know available vaccination centers near our communities?
I
That's a
could.
good question.
Oh, go ahead.
CDPHE actually has on their website, based on where you live, different locations where you can sign up. So if you are in other parts of Colorado and Stride is not close to you, I encourage you to go there. Stride is available on both sides of Denver. So we kind of, our service area is Aurora, all the way down to Parker, Englewood, all the way back up to Wheat Ridge. So we actually have vaccination sites on either side of Denver if that's convenient for you. But vaccination is happening in all different spaces. Like Dr. Terry Richardson said, there's community groups, even, you guys are doing a vaccination event. But then you reach out to your own primary care doctor and ask if they're doing vaccination events. Lots of the hospital systems are doing vaccination events. So there's a lot of opportunities out there, but you do have to be somewhat technology savvy. So if you have family members or friends who aren't, please take the initiative to not just get yourself signed up, but also find vaccinations for your family and friends that might find that a little more challenging.
Thank you very much. Anybody else want to add anything there? Don't forget about the ALG vaccination coming up. You can begin signing up for it on April 7th. And then, from there, we're going to be having it on April 17th. So you can begin signing up. I think there are many, many churches. There are many, many areas wherein you can be able to register to get your vaccines. Go online and check it out, okay?
And I would just add too that if, like I mentioned, our B-Chart educators, because some of the church and community-based programs are not advertising widely, but we get a lot of calls from all over and about these sites. So if you call our B-Chart educator, if you're not able to attend the event that you all are going to have, give us a call, because we constantly are having people reaching out and telling us about different events in the community.
Thank you very much. And the next question is, if you have tested positive for the COVID virus in the past, will you need to take the vaccine? How long is the vaccine effective? That's two questions, actually. Will you need to take the vaccine if you have tested positive? And how long is the vaccine effective? I will put it out to you, ladies, too.
Yeah, I can start. So yes, absolutely, you should get the vaccine. We know that natural immunity, so meaning you are immune after you get infection, might actually be not as strong as the vaccine. So the immune reaction you get from the vaccine is quite strong, and we think lasts longer. So natural immunity estimates are around 3 months. So especially if you had COVID-19 very early on, back in the spring, absolutely 100% go get your vaccine right away. There is some people who choose to wait 90 days after an infection, and that's probably okay. That helps actually, prioritize giving the vaccine to someone else who might need it. But there isn't a harm in getting the vaccine. If you think you might have recently had an infection and you're not sure, if you get the vaccine, it's not going to hurt you if you're too close to that infection. So it's absolutely safe to get it.
Thank you, Dr. Stephanie. This question we go on to Dr. Richardson. When can we unmask once we are vaccinated? Can fully vaccinated people gather?
Yes. So usually they say for the two mRNA, the Moderna and Pfizer, 14 days after you received your second vaccination, you're fully vaccinated. And for the Johnson & Johnson, it'd be, it's just one shot. So there are guidelines that the CDC has put out, and of course, we're still learning a whole lot. But if you're fully vaccinated, certainly in your home, you can not wear a mask. You can connect with people. They also are saying you can also connect with one other household with people that have either been vaccinated or are very low risk for severe disease. So I'm still encouraging people to try to stay at home as much as possible till we learn more. We need to really encourage everyone to get vaccinated. I think it was mentioned earlier about the possibility. I think Dr. Deng mentioned the variant COVID disease that may come about if we don't really get a large number of people vaccinated. So you can congregate, that's a short part of it, but there's some intricacies to it. And so I would mostly say, stay at home, wear your mask if you're out in public.
Okay, thank you very much. This one we go to Dr. Susanna Deng. Are you still there? Right, she's still right here with us. I think so. Anyway,
yes, I am.
Okay, the question is, could one have gotten COVID-19 from the vaccine?
No. It's that simple. No. You are not injected. I can understand people worrying about that with the old vaccine technology where you are injected with either a dead cell or an attenuated bacteria or virus in your body where you get mild disease. But this one is not even the virus itself. It's just an instruction to your body to start forming antibodies that would block the spike protein on the virus from entering your cell and giving you disease. So the spike, what you are injected with is just an instruction for your body to form the antibodies. There is no way that you can get COVID-19 from that.
Okay, thank you very much. And then we go on to Heather. I have a question here for you. It says here, is there any reliable data about vaccine hesitancy rates in the Denver metro area, and more specifically in communities of color in the Denver region?
I actually know the answer to that question, specifically to Denver metro area. I'm guessing it's too soon to have data since this is also new, but I'm curious what the other panel members know.
And I don't really know the numbers, but I know that the Colorado Department of Public Health and Environment presented some data on hesitancy in Colorado, but I do not remember the numbers. I don't know if Susanna may know the numbers, but I know they actually did some studies because they were talking about this, yeah.
It is actually correct that at the beginning of when the vaccine was distributed around January, there was more than 50% hesitancy among people of color. But interestingly, as the vaccine is getting distributed, the number of people who are hesitant, thank God, is actually going lower. And that is because they're seeing people who got vaccinated not being affected in any way. And I think that encourages them, because the majority of people who are refusing to get vaccinated were actually waiting for other people to get vaccinated. So now that more people are vaccinated, they're seeing that there's no influence and there's no negative effect. So they are now joining. So the hesitancy is going down as more people are getting vaccinated.
And I would just add that I've seen from the beginning, it seems like the older populations were not hesitant. They were knocking on the door, can I get my vaccine? I'm more concerned about the younger populations. That's who I'm hearing from now that said, I want to wait, I don't want to get it, I don't think I need it. So that's where I see the youth hesitancy. And that's the group that I think we're going to need to do a lot more work to encourage. And we need like 75% or more of the population to get vaccinated. So we need these young people to come aboard, and you talk with them about why they don't want to get it. And a lot of them are just saying, I just want to wait and see. We haven't had enough experience. That's what I'm hearing from the young people.
Yeah, we're hoping that they will get involved. We know if they get involved, it will help a lot, in this area, and I think it's all of our responsibilities, those who are here, please make sure you talk to your children about it so that they can be vaccinated too, especially the teenagers, 16 and up, you can get vaccinated now. And let's go down to another question here. How is it that the second dose produce more side effects? That's the question. How is it that the second dose produce more side effects?
I can answer that.
Go with that.
Or maybe Dr. Richardson or Dr. Sandhu can answer that or can add to what I'm saying. The reason why the second dose have more side effects is because these side effects are actually an indication of higher immunity. So when you get side effects, it means your body is recognizing it and it's mounting an immunity against it. And because you already got the first dose, the second dose is more recognized by your immune system. So the response is higher. That's why, and I'm sure Dr. Richardson and Dr. Stephanie would agree with me, we consider things like fever a good thing. We consider it an indication of good immunity and a good immune system. So maybe both of them can add any other thing that I might have missed.
I think that hits it is that's the indication that your immune system is working. And that's why they say sometimes with the older population, you may not see as much side effect, because as you age, your immune system tends to decline some. But most people are getting some response, some type of symptom to show that your immune system is working. So I agree with everything that you said.
And if you have side effects after the second dose, it's a good, it means your immune system's working and your body's building up those antibodies. So I just sort of expected it. Not everybody has side effects, but I was planning on it and it sort of embraced it and knew it was my immune system working. And the next morning when I woke up, so I was sick for not feeling well for about 24 hours. In the morning after that, I was fine.
Oh, thank you. Thank you for your testimony too. I think that's very, very important for people to know that all of you that are here today, the panelists have been able to take get your vaccines. Yep. And your experiences also help other people to be able to take their vaccine. I have a question here for Dr. Richardson. He's saying, how is this virus different than the flu or any other viruses out there or in the past? This person says, I am one who has not had the flu and never had a flu shot. How is this virus different?
This virus is deadly. Look at the numbers. Not everyone dies. Some people, some people don't have symptoms that get infected. But if you look at the numbers worldwide, this virus does not play. And it doesn't matter whether the flu is completely different than COVID-19. The common cold, coronavirus is in that family, but this is not the common cold. This is a deadly virus that we have not seen before. We call it a novel virus because we haven't really seen anything this treacherous. And the flu is completely different. And there's many people that say, well, I didn't get the flu vaccine, so I should be fine. They think maybe they've got such a robust immune system, but we've seen people that are very healthy get disease. We've seen people with chronic disease, but you don't have to be a person with chronic disease to get bad COVID. And we're now seeing the kind of the aftermath in people that were previously healthy. They're being left with chronic lung diseases, chronic fatigue, brain fog. So this is not a disease to play around with. It is, I would say, if you want to compare it to the flu, it's the flu on super steroids. It's deadly. And I don't know if you want to add anything more, Dr. Sandhu.
Yeah, I totally agree. And I think I would add to that is you are getting this vaccine, not just for yourself, but for your community. And I think Dr. Richardson and Heather and I and other clinicians on this call know that we have seen the face of COVID and it is heartbreaking. I have held hands of widows who didn't get to say goodbye to their partner of decades. I have held hands of mothers who had to bury their son, who have died from this disease. So while you might be willing to risk it for yourself, getting the vaccine is about so much more than that. Getting the vaccine is about protecting our vulnerable folks who might be on cancer treatment, who can't mount an immune response. to COVID, who folks who aren't able to get the vaccine, maybe because they're young, they're babies, folks who aren't as lucky as you. And I really want to stress that getting the vaccine is a service, like Dr. Harry Richardson said. It is a service to your community. Getting the vaccine is so, so important. And going back to the flu, we have always been concerned about the flu. The flu is something that I 100% think you should go ahead and get the flu shot, because those deaths are real as well. But when you compare the numbers, I mean, it is crazy that despite shutting down, despite the mass social distancing, which worked, to be very clear, we still had almost 500,000 deaths just here in the United States. Mm-hmm. If that hadn't been the case, we would have had millions if we hadn't taken those precautions. Those numbers are nothing like the flu. This virus is so deadly and so easily transmissible, largely because of the fact that it's almost silent. It can spread through our communities in folks who are asymptomatic, and it's very, very hard to contain. So it is different than the flu. The flu does not overwhelm our healthcare system the way that COVID-19 has and can if we let it go unchecked. So please, please, please get your vaccine.
Oh, thank you. Thank you very much. And we have two questions coming up now. One's going to Heather, and the other one is coming to you, Dr. Sandhu. The first one that goes to Heather is that there had been talks about the appearing of lumps in breast for women after getting the vaccine and going for mammogram. How long should women 35 or older wait after getting the vaccine to go for next mammogram?
Yeah, I think 8 to 10 weeks is the current guidance after your after the vaccine. Wait about 8 to 10 weeks, 10, I believe, to go get your mammo. And it's not dangerous to get the mammo sooner. It's that you may have some abnormal findings just from maybe swollen lymph nodes from the vaccine, which would then make the radiologist worried, and you'd have to have a repeat mammo. When in fact, your lymph nodes may be a little bit swollen just because you got the vaccine. So the vaccine does not cause breast cancer, any kind of cancer in that realm. It can, mount your immune system can have a reaction where you get swollen lymph nodes, where the mammo can show those. And then we need to, of course, repeat the mammo, make sure the lymph nodes, the swelling goes down. So about 10 weeks.
Okay, thank you very much. And Dr. Sandhu, it says here that I heard, we are having a lot of questions I had, but what people have had, he said, I heard that the Johnson & Johnson vaccine is going through your DNA. Is it safe? I think somebody mentioned that, but you can go ahead and answer that, Dr. Sandhu.
Yeah, like has been said before, it is definitely safe. I feel very confident in that. I sat down, I've reviewed the safety data, and this was one of the easiest medical decisions of my career when I looked at the data. I said, COVID-19, very deadly, very serious. Vaccine, very safe, been tested. So I want to stress that it is safe. It does not affect your DNA. That is not how these vaccines work. It is not going to long-term alter your genes. It is safe, and I feel very confident in saying that.
Okay, guys, we have that right. It is safe. It doesn't go through it. It doesn't alter your DNA at all. Okay, it doesn't alter your DNA in any way. Just remember that, please. And then I have a question here for Dr. Deng. When can we go back to normal without masks? Is that anytime soon?
This is where the concept of herd or community immunity comes in. Mm-hmm. This is not a sprint. If you get the vaccine, remember that immunity is not only for you, but for the entire community. Until 70 to 80 to even 85% of the population is vaccinated, we cannot really feel comfortable and confidently say that, okay, off with the mask, off with the social distancing. So taking the vaccine is one step in the entire battle, and you need to make sure that your family, your community, your friends and loved ones get the vaccine before you take the mask off and stop the social distancing. The CDC guideline is very clear. People who are vaccinated can congregate together without the vaccine or in the presence of somebody who is low risk. But in the community, you will still have to behave as if COVID-19 is still there, because it is still there until 70 to 80 to 85% of the population is vaccinated. That's when life can go back to normal. We have to be a little bit patient when it comes to that.
Okay, thank you. Dr. Richardson, there's a question here that says, what medications can I take before and after taking the vaccine? Can I take over-the-counter meds?
I don't know if that's in reference to taking something like ibuprofen. I know there was a time people were wanting to kind of pre-medicate before they got their vaccine to cut down on the pain in their arm, and they definitely were advising against taking those medications before you got your vaccine, your COVID-19 vaccine. So nothing like Motrin, Advil, Aleve. If you're on regular medications that you take every day, then you could still go ahead and take those. And I don't know if someone might want to clarify if they are speaking specifically of something. You know, if you're on blood thinner, you go ahead and take that. If you're on other medications, but was there any more specificity to the question? Because it just said medications.
Well, I think it's practically like those people that have regular medication that they take on a regular basis, their prescribed medications. Should they take it before taking the vaccines and after taking the vaccine?
Yes, continue with the regular medication, with only the caveat about the ibuprofen and those types of medications. Don't take it before your vaccine.
Okay, thank you. There's another question here that there was a recent recall for Johnson & Johnson vaccine. What effect does this have on the reliability and safety of this one? I don't know about that, but I don't know whether you ladies have heard about it. Recall of Johnson & Johnson vaccine.
I have not heard about a recall. I try to stay on top of it, but I have not seen or heard anything. I know we're actually administering Johnson & Johnson here in Colorado. It's hard to find, but I know King Soopers has it, and the new Pepsi Center, that's now the Ball Center, also was giving out doses. So I hadn't heard anything. Has anyone else heard of any problems with the Johnson & Johnson?
I think they might be referring, and I guess I wouldn't consider this a traditional recall. So they're not recalling it because they're concerned about the vaccine, but there was a production issue recently where a particular site that was going to manufacture the vaccine, there were some quality issues. And so they're no longer using those doses. So I don't see that as, and I think that actually is proof of the safety guards we have in our system, that we have quality checks to make sure that it's being manufactured properly and effectively. So I think there was, unfortunately, millions of doses that aren't going to go out, but those never went out to anyone. And it probably would have it would have affected the effectiveness. It wouldn't have been unsafe, but they chose not to distribute those vaccines because of concerns about the actual production. It wasn't actually the vaccine that's getting the recalls. The vaccine is safe, and I agree with Dr. Terry Richardson. I have not seen any concerns about recalling it because of the safety of the vaccine.
Okay, thank you. And well, this one specifically is directed to Dr. Sandu, Dr. Stephanie. I have heard Dr. Stephanie saying there after contacting the COVID-19, we have to take the vaccine. What about the natural immunization? I don't understand this question, but that maybe you can be able to answer this.
Yeah. So natural immunity is important and can be quite effective. But we do know, particularly with COVID-19, that it wanes over time. So when you get sick, your antibodies don't last forever, unfortunately. And we know, particularly with what we call natural infection, so when you get sick, those antibodies can over time go down. When you have a vaccine, your immune response is very targeted. It's focused on building immunity. So that immunity is actually stronger when you get a vaccine. and we think will likely last longer. We still don't know how long, but we think it lasts longer than getting a natural infection. So that's why it's so important for you to get a vaccine if you've had COVID-19. And I actually have had this happen. So I've had patients who got sick in the spring, had a COVID-19 infection, tested positive, went on to test negative, were fine, doing well, and got infected again. And that is why it's so important for you to get a vaccine, even if you've had an infection, because unfortunately, reinfection does occur, and we have seen that.
Okay, thank you very, very much. And there is one more question here. It says, does the vaccine have the sterility effect? And
Understand the question. Sterility?
Yeah.
No, I've never heard of it. Did any of you hear, Dr. Stephanie and Terry and Heather?
Yeah, I've heard that out there as one of the things that people are, that's out there on Facebook, that, you know, you'll become sterilized, both men and women, but that's not true. That's again, one of those urban myths that are out there that gets asked a lot because people are really concerned about it.
Mm.
Yeah, and I practice prenatal care as well. And I would say that if you're trying to get pregnant, get the vaccine right away. We know that COVID-19 infections have been associated with things like preterm birth, complications during your pregnancy, miscarriages. It's very important to take this as an opportunity to go get your vaccine to be as safe as possible during pregnancy. I have heard that rumor as well, and it was not backed by science. The ACOG, which is our Association of Obstetrics and Gynecology, has come out and said very strongly people should be offered this vaccine. We think it's safe. And if you actually look at some of the data, there was people in these trials who did get pregnant, and they were able to follow them and look at their outcomes. Even if they weren't pregnant before they got pregnant, but they were able to get pregnant after.
Oh yeah, thank you so much, able presenters. We're going to take the last question. It says here, what motivated some doctors and healthcare professionals to go on social media and say that COVID-19 vaccines were not safe to the Black people in the first place? I don't know whether you have heard about it. Dr. Richardson?
I've not heard about it. I've seen lots of Black doctors that have gone out there and said, we need to get this vaccine. Let's not be at the back of the bus. Let's get to the front and get the vaccine, and really to be, really to understand that it's safe and effective, and it's been tested in our community among Black people. So it is safe for us. So I don't know anything about people stating otherwise. Does anyone else? Has anyone heard?
I think the challenging thing about social media is all it takes is one voice to make it look like the narrative is that we're divided. And I agree with Dr. Terry Richardson. We are not divided. There is consensus amongst the medical community, and every single physician and clinician I know believes this vaccine is safe and you should get it. And I think, unfortunately, in Facebook, there can be this false dichotomy between one random voice. I don't even know if they're, who claim to be who they say they are, and make people think that there isn't a consensus in the medical community, when in fact there very much is. I've seen surveys of close to 100% of physicians believe this vaccine is safe. And I would anecdotally agree with that. Every single friend I have who is in the medical community, whether they're a nurse practitioner or a PA or a physician, has gotten the vaccine themselves and are telling their patients to get it.
And I would also like to add that for the population in general, we need to be careful where we get our information from. You just can't go to any website or any YouTube video and believe that it is the authority. And I agree with Dr. Stephanie. I know what she's referring to, because some people come with white coat and claim to be doctors and make preposterous statements that that are not backed by any science. Try to go to WHO, try to go to CDC, NIH, go to reputable websites, and this is how you actually enlarge your thinking and perspective, and that's what we should all do. I'm calling upon you to do that. Go to reliable sources. Don't believe anybody who comes and say they're a doctor or a scientist when they are not. Thank you.
Oh, thank you, ladies, so much. And somebody is begging us to do something. So ask their question, please. And if you don't mind, hello, thank you for being here. I have two questions, if you don't mind. One, is there any difference between the content of the first and second doses? Number two, is it okay to get both doses in the same shoulder?
I can take this one if you want. There's no difference between this first and second dose. It's just you get 2 doses because you want to really build that immune response fully, and that's what you get after the second dose. And it is okay to use the same arm for this first and second dose. As long as you don't have any active infections or anything, it's totally fine. I did.
Thank you very, very much. We really appreciate you ladies coming up. And Dr. Deng, we appreciate you very much. Dr. Richardson, Dr. Sandu, and Heather, we appreciate you all very, very much. Just know that this is not the last time.
Can I mention one thing?
Yes, go ahead.
Yeah, I just want to add that if you are traveling and you know that you're not going to be able to get your second dose on time, whether it's 21 days for Pfizer or 28 days for Moderna, it's better that you get the one where you get only 1 dose, like Johnson & Johnson, because it's important to take both doses within a certain time frame. It's 28 days, but of course it can be a little bit of a few more days after that. But if you're traveling, especially among the diaspora, if you're traveling and you're going to Africa and you're not coming back except after 2 months or 3 months, don't take the first dose of Moderna and Pfizer. Instead, take the one where you can get only one dose. So thank you. That's all I wanted to mention. Thank you. And thank you, ladies, for I really enjoyed having you. Really enjoyed getting to know you. Thank you.
Yeah.
You as well. Thank you.
And we're going to say this will be not the last time. You asked Dr. Richardson for us, ALG. We're going to be having you, again and again to come and support us in various ways. Thank you. Thank you so much. Really appreciate it. And
thank you for having us.
Thank you.
Now we will announce the winners.
Okay.
Amadou.
All right, great. Thank you. And thank you everyone for joining us tonight. And thank you for playing along with us. For the winners tonight, we have Mr. Jeremiah and Jason Golden and Jeremiah. So I don't really know if you qualify, but you are the winners. So. But yes, if you would please chat in your email and addresses to Laurie, directly to Laurie Collier. As an address, so we can send you your prizes. Thank you.
And Abdul, give the closing remarks, please.
Okay, well, once again, we do want to say a big thank you. I want to clap my hands, clap our hands, to a big thank you to all of you, our panelists, Dr. Deng, Dr. Richardson, Heather, and Dr. Sandu. Thank you so much. We really, really appreciate you taking off this afternoon, a day before Easter, to come and join us. That's really, really, really wonderful. We really appreciate every one of you. And for those of you who also signed on today to listen to all of what we hope we have been able to answer all of your questions, and that you have, and we hope we have been able to persuade you to go ahead and take your vaccine. It is very, very important to go ahead and do that. And don't forget about the vaccination coming up that will be organized by ALG. We start signing up for it on the 7th of April, and then it will be on the 17th of April, wherein we'll be having vaccination at the ALG office. And on behalf of the African Leadership Group, thank you to all the speakers and presenters for sharing valuable information with the community. This has been an incredible informative session. We appreciate you all offering some specific answers to help us prepare for the next chapter of COVID. Thank you all. And may the Lord God bless you and have a good week.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Bye, guys.
Bye.
Bye.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you, everybody.
Bye-bye. Thank you.
Thank you.
Bye,
All.
everyone. Thank you. Thank you,
You're
Papa.
welcome. Thank you. Thank you for coming.
Thank you, Amadou. Thank you, Uzi.
Thank you.
Bye.
You guys are awesome in the office there.
Bye, Papa.
Thank you.
And everyone.
Bye. Thank you.
Thank you, Papa. Thank you, everybody. Bye.
Papa is asleep.
Yeah.
Might be.
Thank you. It was a great job. Thank you, guys.
Awesome. Thank you,
Thank you.
Fish.
Thank you, Fish.
Thank you. Thank you, Alan. Thank you, Majama. Jason.
And for 7 News, thank you.
Denver 7 News. Thank you. Also, thank you. Negusi, thank you.
And what time is it?
It's about to be 5 o'clock. 3 minutes till 5.
On time. I love it. You guys are amazing.
All right.
Amazing.
I think Majama's asleep probably. I'm gonna just.
Should we stop? We'll stop recording.
Yes. Can we remove?